Hello and welcome to the Osteo Physio YouTube channel. For today's video we are going to be addressing how the modern posture impacts our lower backs. We are going to be looking at the main conditions and symptoms that arise when we're slumping and being very static during the day, what you can do to help with each of those and how you can manage them, and then I'll gift to you to help you long term maintain these sustainable changes and prevent injury. So what do we mean by the modern posture? So this is something that we have addressed in other videos, and what I mean by this is habits that we do day to day that cause us to slump and compress through the body. So for the lower spine, this might be when we're driving and we haven't got any support, so by the end of the long drive we just feel really sore. It might be the habits that we do day to day when we're working that puts pressure through that lower back. It might be if we're leaning forward or we're slumping or we're lifting something from an awkward position. What this typically causes in the short term might be a bit of tenderness there, but the real complications arise when stuff repetitively occurs over time and causes problems long term. So how is the modern posture influencing the lower back mechanics? So what our curves should look like, we should have a lovely S-shaped curve through the spine. So nice and balanced with the lower back in actually quite a nice extended position. What happens though when we're leaning forward and we're slumping and we're compressing during the day, it puts a lot of pressure down through the body. And so what this does is it changes the mechanics and it changes the position of the curves over time. So we typically get the neck coming forward, so we get that anterior head carriage, we get an increase in the curvature, typically, again, not everybody follows this pattern, but the majority, increase in that upper kyphosis, so curving of the spine, and then what we find is we actually tend to straighten through the lower spine. So what we're focusing on today is the impact of this long term. So if we've lost the natural and the anatomical curve of the body, what this does first of all is it actually puts more pressure and abnormal and excessive pressure through the structures of the lower spine. This includes the joints, the discs and the surrounding musculature that are adding that support. This then induces a series of conditions to arise. Number one, and actually probably the most common, disc problems. So probably the most common between the ages of 35 and 45, as we have that natural hydration through the disc, is it increases the risk of a person having problems or injury to the disc, whether it's a disc prolapse or a disc herniation. Just to put it into perspective in terms of pressure through the disc, say for example you're sitting and then you go to lean to grab something, because of that position, that is the most provocative position to aggravate a disc. So what happens is you might be sat at work, you might go to lean to grab something, and if you've been having this abnormal or excessive pressure for a while, it then causes the problem to arise. So it can either cause localised band-like pain across the lower back, or even, depending on the severity, start to cause symptoms of sciatica, so nerve pain down into the leg. So as we get older, so typically over 45, we naturally lose the hydration of our discs. So we naturally lose the amount of lordosis anyway. If we've also got this poor posture and excessive pressure, how the body deals with this is it starts to try and stabilise even more. And so what can arise and what can occur is increased stiffness and rigidity into the lower spine with that excessive pressure, so possibly causing localised or referred pain. This is called DDD of the lower spine, so degenerative disc disease. So we get a loss of disc height and pressure through the joints. Like we said, stiffness, rigidity and pain around this area. Finally, the third thing I want to have a look at into the lower spine is postural muscle issues. And so what I mean by that is if you change, this can occur at any age and in association with other conditions, if you change the curves of the spine, so we've dropped it underneath and we're putting more pressure into the lower back, as we slump we put more pressure also through the postural muscles to add that stability and support. The more we do this, the more likely we are to cause localised pain and ache into these muscles. But what also happens with any muscle, if you're contracting and contracting and contracting and demanding that muscle, after a while what it might lead to is a spasm through the muscle. It cannot compensate for this posture, and this is where we see people where their back seizes up or it spasms and people are in a lot of pain. So what can help with these conditions and manage the symptoms and stop injury long term? So what we have created for you is a healthy lower back manual, and this addresses all elements required to get the lower spine moving, to strengthen through and to feel better in terms of reducing pain. What we look at in the manual is mobility, strengthening in terms of core activation, pelvic floor activation and strengthening through the postural muscles, as well as stretching through key areas to reduce that pain and tightness.